this is Dr. Duretner Hassan, reproductive endocrinologist and infertility specialist in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family. Here to talk to you today about genetic testing. Now we throw around the terminology genetic testing quite a bit, but there are different types of genetic testing. The first one you are very familiar with, and that's ancestry screening and genetic predisposition to certain health conditions. These are commercialized tests. The most commonly utilized one is probably 23andMe. You have access to this testing and can do this on your own without doctor's orders for the testing. These tests are great for tracking ancestry and for seeing if you're genetically predisposed to certain conditions like diabetes. The second type of genetic testing is genetic carrier screening. Genetic carrier screening is offered to pregnant women and women who desire to become pregnant in the near future. And it literally means what it says. It tests them to see if they carry the genes for certain genetic disorders. Now, these are genetic disorders that are typically recessive disorders. Many times women carry the genes for these disorders but do not have symptoms of the disease. It becomes more problematic if both her and her husband carry the gene for the same disorder. They're at elevated risk of having a child with the actual full-blown disease. Certain conditions that fall in this category include cystic fibrosis, spinal muscular atrophy, Fragile X, thalassemias, and sickle cell. Another type of genetic testing is called pre-implantation genetic testing, which means testing the embryo prior to implantation or before we put the embryo back into the uterus. The most commonly utilized version of this is called pre-implantation genetic testing aneuploidy screening, PGT-A. Genetically normal embryos that carry the correct number of chromosomes or gene regions are called euploid embryos. Embryos that carry incorrect number of chromosomes or gene regions are called aneuploid embryos. Euploid embryos are more likely to result in a pregnancy. Aneuploid embryos are more likely to result in a negative pregnancy test or a miscarriage. So doing pre-implantation genetic testing aneuploidy screening prior to transferring the embryo to the uterus can really increase a woman's chances of having a successful pregnancy. Another type of genetic testing called pre-implantation genetic testing monogenic, and that tests for a specific gene prior to transfer of the embryo. So I utilized a disorder earlier on called cystic fibrosis. That is an autosomal recessive disorder where a mom and dad can carry the gene and never have the disease. But the child can inherit both copies of the gene and therefore can result in having the full-blown disease. So we can do pre-implantation genetic testing monogenic and screen for that specific gene, that code for cystic fibrosis, and therefore avoid transferring an embryo that has the full-blown disease to the woman's uterus. I discuss more about genetic testing as well as other aspects of fertility in my book, The Fertility Manual, Reproductive Options for Your Family. To learn more about me or my books, please visit www.noorhasan.com. Please like and subscribe to my channel to learn more about fertility.